You are welcome to my channel. Today I'll be talking about a medication that is not strange to you, and that is haloperidol. Perhaps you have somebody around you that's on this medication under the trade name Haldol mostly. This is the presentation you need to listen to, because I'll go over the class, the form, how to administer it, the mechanism of action. I'll go over all possible known side effects, some warnings, to all of us, the contraindications, and I'll go over certain examples where and when we can use Haldol. Thank you for listening. Let's go into the topic proper. Haloperidol could be under different brand names like Haldol, Haldol decanoate, Apple haloperidol, PMS haloperidol, or Teva haloperidol. Haldol belongs to the class of medications known as first-generation antipsychotic, or also known as typical antipsychotic. The reason is that we have second-generation antipsychotics like olanzapine, risperidone, and so on, and they are known as atypical antipsychotics. It could appear in various forms, like concentrate per oral under the generic as 2 mg per ml, or solution for intramuscular usage, and in that case we can find adult decanoate at 50 mg per ml or 100 mg per ml. Still under solution for intramuscular injection, we can find generic 50 mg per ml or 100 mg per ml. Solution for injection as lactate is also available, and in that case you can find Haldol 5 mg per ml or generic 5 mg per ml. It could come in form of tablets per oral, and in that case we can find generic at variable dosages 0.5 mg to 1 mg to 2 mg, 5, 10, and 20 mg. Uses. Haldol or haloperidol is pretty useful in the face of acute agitation, aggression, acute hypomania, severe agitation or severe aggression, schizophrenia, substance-induced acute psychosis, acute manic or mixed episode, but not for bipolar involving major depressive disorder. Also useful in chemotherapy-induced nausea and vomiting, in severe hyperactivity in children, delirium, in palliative care with nausea and vomiting, postoperative nausea and vomiting, and Tourette syndrome. So here, this is giving us the clue why that patient in cancer ward is on haloperidol. Not because he or she is psychotic, but because the doctor is trying to handle the chemotherapy-induced nausea and vomiting. And when a young guy is having severe hyperactivity, can be placed on Haldol just as Tourette syndrome. Administration. The oily decanoate should be given intramuscularly only. That is adult decanoate. We will never give the decanoate intravenously. And we can use a big needle like 21G for intramuscular administration. And nothing more than 3 ml could be given into the gluteal muscle, and it should be given deep RM. You may use Detroit as well. The non-oily injection solution, that is the lactate, can be given intramuscularly or intravenously at 5 mg per minute or subcutaneously in palliative cases. Please have EKG before the administration of this medication to rule out prolonged QT. Because with prolonged QT, there will be torsade point. With torsade point, without correction, then there will be tachycardia. Okay, it will be initially monomorphic ventricular tachycardia, which would degenerate to polymorphic ventricular tachycardia. If no correction on time, then it will degenerate to ventricular fibrillation. Without defibrillation, it will lead to asystole. Without advanced cardiac life support being put in place within minutes, the patient will end up in the morgue. Still on administration, when you are giving haloperidol per aura, that should be given with milk or with food. And why that? To prevent or at least decrease gastrointestinal tract upset. The lactate is an immediate relief form of haloperidol, and we can use it for intravenous or infusion purpose. It could be diluted with D5 or ringers or given undiluted. Note this, don't discontinue haloperidol suddenly, but we have to do that gradually. If you are switching from haloperidol to another medication or from another medication to haloperidol, we have to gradually, now we are dealing with two medications, right? We have to gradually decrease the one the patient is on right now, while we gradually increase the dose of the new one. Drug-drug interaction. Please kindly contact the pharmacist, clinical pharmacologist, and better still, the psychiatrist. Why that? There's a long list that I cannot exhaust right here. Warnings. Don't use this medication in children and adolescents. You have to contact your psychiatrist or pharmacist if you must use this medication in children, please. Intravenous use is even more dangerous because it can lead to respiratory depression, extravasation, and death. Please, if you must use this intravenously, let your pharmacist or psychiatrist approve that. Still on warnings, elderly patients are at increased risk of death when they have dementia and they are placed on our door at the same time, particularly Lewy bodies dementia. In dementia-related psychosis, as found in Lewy bodies, Adderall is contraindicated. If elderly, but no dementia, you may use Adderall for other reasons, but please, very low dose and for the shortest period of time. Still on warning, because of the fear of prolonged QT and the sequelae that I've explained the last four slides, please have EKG before you administer this medication. And watch out for anticholinergic effects like constipation, xerostomia, blood vision, urinary retention. Please watch out. And also, we might be battling with leukopenia. And with that case, with leukopenia and neutropenia, and also agranulocytosis, there will be overwhelming infections. Central nervous system depression is also possible here. Still on warning, we might be battling with esophageal dysmotility, aspiration pneumonia, increased force, particularly in elderly, hyperprolactinemia. You see, this is a problem for women of childbearing age, right? So we need to explain this to them before they commence, because with hyperprolactinemia, they may now come down with infertility problems. Anaphylaxis is possible, and of course, neolytic malignant syndrome is very possible here, on account of which the individual will be admitted into the emergency room. Orthostatic hypotension is possible, and temperature dysregulation is very common. We're still on warnings, and one of my friends is saying, why do you keep talking about warnings and all these things? Yes, we have to. We have to, because it's better that the patient will know exactly what they're going to face, so that when they are faced with that, they will not be disappointed that we've not told them. Okay? So we have to avoid this medication in thyrotoxicosis. You can check my channel for full presentation on thyrotoxicosis, please. Be careful in cardiovascular diseases because of the fear of arrhythmia, prolonged QT, and so on. Be careful in bipolar, and why that? It can treat mania to depression. In fact, most of us will not even use Adol here. Can exacerbate myasthenia gravis. So you can check my channel for full presentation on myasthenia gravis as well. And be careful in schizoid disorders. Adverse reactions, extrapyramidal side effects. The first one to occur is acute dystonia, just from the name acute. Actasia, pseudoparkinsonism, and tardive dyskinesia. I will not waste your time here because extrapyramidal side effects is a major topic that is worthy of separate presentation on its own. There, I'll be dealing in details when it comes to acute dystonia, actasia, pseudoparkinsonism, and tardive dyskinesia. Central nervous system effects could lead to drowsiness, headache, hyperkinetic muscular activity, and oculogeric crisis, just as could be found in acute dystonia. Other side effects will include anxiety, euphoria, lethargy, vertigo, increased aquatic symptoms, diaphoresis, hyperglycemia, hyponatremia, and impotency. Also, the side effects or adverse reactions could include menstrual irregularities, and just like what I've said in the last 2 or 5 minutes, that hyperprolactinemia will give women of childbearing age a lot of trouble when it comes to fertility. Increased lactation, that's hyperprolactinemia, increased cataract, anorexia, diarrhea and dyspepsia, retinopathy, visual disturbance, granulocytosis, abnormal liver function test. Still on adverse reactions, amenorrhea, anaphylaxis, arrhythmia, bronchospasm, gynecomastia, insomnia, arousing, and weight gain or weight loss. Okay, contraindications. Haloperidol is contraindicated in anyone that is hypersensitive to haloperidol in the past. Anyone with Parkinson's disease should not have haloperidol. Okay? And anyone with central nervous system depression or in coma, dementia with Lewy bodies, young children, and spastic diseases must not take haloperidol. Monitoring. First thing first, get EKG and follow up with vital signs, mental status, lipid profile. Remember, the weight will be affected, right? So weight, electrolytes, prolactin because of the probability of hyperprolactinemia. Liver function test, remember I just mentioned that the abnormal liver function test. Random blood sugar, fasting blood sugar, hemoglobin A1C because there's likelihood of hyperglycemia. Complete blood count because of leukopenia, neutropenia, and therapeutic range should be determined because it should be between 1 to 10 nanogram per ml. And we have to take the sample for that before the next dose. Mechanism of action. This is a butyrophenol. It will not selectively block postsynaptic D2 receptor in the brain. Examples of situations when and where we can use haloperidol are the following. Agitation and aggression. In acute cases, you can give Adol 2 to 5 mg IM or immediate release lactate 2 mg intravenously, but please be careful. Be careful because you can run into a lot of trouble with intravenous use. Better still, inform and involve your psychiatrist or pharmacist. You can repeat the dose every 15 minutes. Change to every 30 minutes up to 6 hours if the situation is no longer acute. But the maximum dose that we could give per day is 30 milligrams. You may choose the bipolar route, and you can give 2 milligrams to 5 milligrams or 0.5 to 1 milligram. You may repeat this every 6 hours as may be required. But remember, the maximum dose we could give per day is still 30 milligrams. In acute manic or hypomanic state, we can give per hour at 2 to 10 milligrams or 0.2 milligram per kilogram per day up to 15 milligram per kilogram per day in 1 to 2 divided doses. We can increase by less than 5 milligram every 2 days until the maximum dose of 30 milligram per day is reached. When we reach that bar, no more increment. Also, in chemotherapy induced nausea and vomiting, like I said earlier, that this is the reason, or let me say might be the reason, because the fact that somebody is down with cancer doesn't mean he or she couldn't have been diagnosed with psychosis before, okay? So when somebody is not having psychotic features and is in cancer ward or oncology ward and is being placed on her door, please, as a nurse, don't bother. It might be because of the nausea and vomiting induced by the chemotherapy. So we can give per oral or intravenously a dose 0.5 to 1 milligram every 6 hours as may be required. Still on examples of where we can use Haldol. If this is palliative care and you are dealing with nausea and vomiting, you can use Haldol lactate injection. And you can give this through different routes, like intravenous route, but be careful. You can give it subcutaneously. You may choose the oral route, or you can give it as subcutaneous continuous, subcute continuous. You can choose the dose from 0.5 milligram to 2 milligram, and you can repeat this every 6 hours, or you extend the interval to every 8 hours. The last example, schizophrenia. Here, adult decanoate extended release suspension could be used. And we should give this intramuscularly every month. We can start from 100 milligram to the maximum dose of 450 milligram monthly. But sign a consult with a psychiatrist before you embark on this journey, or you contact your clinical pharmacologist or pharmacist before placing that patient on this medication. Let the family members know and watch out for certain features of extrapyramidal side effects or neuroleptic malignant syndrome. Also, remember, Haldol is not helpful to elderly, particularly elderly men and women with dementia. And now dementia with Lewy bodies will even be worse. And when you need to give this medication in pediatric age group, please let your psychiatrist, clinical pharmacologist, or pharmacist be part of that decision. And let every patient know all the warnings stated here and all the side effects. With that, I've come to the end of this presentation. Remember to share this very presentation with everybody using this medication around you. Also remember to subscribe so that you can get my presentations immediately they are published. My goal here is to decrease pain and reduce death worldwide. Thank you.